Welcome. I'm Mandeep Dhaliwal, the director of UNDP's HIV and Health Group. I'm pleased to welcome all of you on behalf of the three co-organizers of the webinar, the Ministry of Foreign Affairs of Japan, the GHIT Fund, and UNDP. Ahead of the TICAD8, the objective of this webinar is to discuss the role of partnerships in building health system resilience and health security in Africa. To this end, we are delighted to bring together a distinguished panel to share insights on measures to achieve health security and ultimately human security. We're keen to hear from a broad range of people on what it takes to develop future-forward strategies that can help us to effectively address gaps in the innovation, access, value chain in low and middle-income countries. An end-to-end approach that assures availability, access, and timely delivery of needed health technologies is crucial for pandemic response and preparedness. We know that global collaboration and partnerships at scale and speed are possible. We've seen this in the collaboration for research and development of multiple COVID-19 vaccines. But there were and continue to be deficiencies in our collective response to COVID. All of this provides useful lessons for the future, for improving existing pandemic responses and being prepared for future pandemics. At the same time, we cannot neglect other health priorities and pandemics, including tuberculosis, malaria, and neglected tropical diseases. These persist in many low and middle income countries, including in Africa, with significant health, economic, and social consequences. In 2020 alone, COVID-19 related disruption caused TB and malaria diagnoses to drop by 59% and 31% respectively. And there were 1 million fewer people treated for TB and 45,000 additional malaria-related deaths. So there's still very much an urgent need for safe and effective tools to prevent and diagnose and treat NTDs, which continue to impact 1.7 billion people worldwide. The scale of the challenge and the disease burden is significant. Over 500 million people in sub-Saharan Africa are at risk of NTD infection. In 2019, there were over 360 million cases of NTDs, causing a total of 5 million dailies. Existing socioeconomic vulnerabilities and inequalities in sub-Saharan Africa exacerbate the threat and impact of NTDs, highlighting the urgency in addressing this gap. The poorest households with the lowest levels of education are twice as likely to be infected with NTDs, which in turn perpetuate an already high social and economic burden. Addressing NTDs requires an equity-based approach, one that will support health and well-being of those most vulnerable. And just reflecting for a moment on the campaign to eradicate smallpox, that started first in the poorest countries. So very much an equity-centered approach. So we know that there are things that we can learn from the responses to other infectious disease. We also know that progress is possible in NTDs. Earlier this month, Togo became the first country to eliminate 4 NTDs. Ultimately, equitable access for health services for TB, malaria, and NTDs is an important benchmark of progress, of robust and resilient health systems that will advance progress towards pandemic preparedness and universal health coverage. Innovation and access are central to equity, health security, and human security. So finally, before we start, just to remind everybody, please share your questions for our panel speakers through the QA box, not the chat box. And I'd also like to just remind everybody that language interpretation is available in English, French, and Japanese, and you'll see a little globe icon at the bottom of your screen. You can use that. It's now my great pleasure to welcome the statement from Dr. Satoshi Ezue, the Director of Global Health Policy Division at the Ministry of Foreign Affairs for Japan. And his statement will be the opening address for our panel. Unfortunately, Dr. Ezue was called away on some urgent high-level business at the last minute relating to discussions at high-level discussions that are going on around TICAD. So it's my pleasure to introduce Ms. Ayami Nonomura, who will deliver his statement. Ayami, you're very welcome.
Thank you, Dr. Mandeep. Nice to see you all. So first, I would like to present sincere apologies that Dr. Ezue cannot attend this webinar today, as very urgent matter has come up at the very last minute. So I'm Dr. Ayami Nonomura, and I got a message from Dr. Izoe, so please kindly allow me to make opening address on behalf of him. So thank you very much for joining us online from all over the world today. I am pleased to co-host this event with GHIT and UNDP. Achieving universal health coverage, UHC, is a major goal of Japan's global health diplomacy. First, I would like to briefly mention the relationship between Japan and UHC. Japan introduced universal health coverage in 1961, and it has established a system in which all citizens can receive high-quality medical care without a heavy financial burden. It became one of the major cornerstones of post-war economic and social development, and it has contributed to building a society with the highest level of health and longevity in the world. Based on this experience, Japan has led efforts for achieving UHC in the international society, such as introducing the concept of UHC into SDGs and launching UHC 2030, an international initiative to promote UHC at the G7 Iseshima Summit in 2016. Also in Africa, Japan has contributing to strengthening health systems for many years through capacity building of the infectious disease control and regional research hubs, such as Noguchi Memorial Institute for Medical Research in Ghana, Kenya Medical Research Institute, and Africa CDC in order to achieve UHC. On the other hand, even since pre-COVID, at least half of the world's population, including Africa, are not able to obtain essential health services. The situation is getting worse due to the global spread of COVID-19. Human security is threatened all over the world, including Africa, and the efforts to achieve UHC, such as strengthening health systems and establishing better human security, are required than ever. In particular, the relatively large amount of resources devoted to COVID-19 response has impacted on measures against the other traditional infectious diseases. For example, infectious diseases such as neglected tropical diseases, NTDs, malaria, and tuberculosis have caused a cycle of health inequities and poverty on a global scale, such as in Africa. And the situation is getting worse due to COVID-19. Supporting R&D of medicines for these diseases is extremely important in order to realize the principle of UHC, which is leaving no one's health behind. Japan has promoting R&D of pharmaceuticals for such diseases through public-private partnerships. In 2012, the government of Japan contributed to the launch of GHIT, Global Health Innovative Technology Fund, which is a pioneering international public-private partnership that promotes R&D of therapeutic drugs, vaccines, and diagnostics for NTDs, malaria, and tuberculosis. Also, since 2013, through collaboration with UNDP, we have contributed to promoting access and delivery of medicines, as well as strengthening health systems in low and middle income countries. However, due to the impact of COVID-19 pandemic, programs for controlling those diseases are suspended primarily in low and middle income countries. As a result, the number of cases and deaths from them have increased. Furthermore, the concentration of international support on COVID-19 has caused issues such as stagnation of new R&D for diseases other than COVID-19. Despite such circumstances, GHIT and UNDP are to embark a new 5-year strategic period from next year. The partnership of Japan, GHIT, and UNDP is critical to stimulate R&D for new drugs, to strengthening health systems in Africa, and to support rapid and effective delivery.
総務課国会業務支援室よりお知らせいたします。明日は参議院厚生労働委員会において閉会中審査が行われますが、本日の国会関連作業はございません。以上です。
Thank you. This point is also stressed in the global health strategy developed by Japan this May. Based on the experience from COVID-19 response, the two pillars of strategy is, firstly, to develop global health architecture and strengthen PPR, which is prevention, preparedness, and response in response to public health crises, including pandemics. And secondly, to achieve more resilient, equitable, and sustainable UHC. R&D of pharmaceuticals for diseases such as NTDs through public-private partnership will contribute to these policy goals. If Africa is not healthy, our world will not be healthy, and UHC won't be achieved. The government of Japan will continue to address the various health issues in Africa, including NTD control through partnership with GHIT and UNDP, and continue to lead the efforts for building better health security and to achieving UHC in Africa. Thank you so much.
Thank you, Ayami, and please convey our thanks to Dr. Ezue for his remarks, and thank you for stepping in to share them with us. I think we're off to a good start. His remarks have set, I think, a very important context for the panel discussion to follow, and they raise a number of key points that we should keep at the forefront of our mind. And one is that building resilience of national health systems and prioritizing universal health coverage are important for pandemic prevention, preparedness, and response, and human security. Secondly, the need for partnerships to stimulate R&D for new needed health technologies and to strengthen the health systems in line so that they're ready to deploy these rapidly and effectively and to reach those in need. And that these are essential for achievement of pandemic preparedness and for UHC. And finally, the link between poverty and health inequities and the implications for pandemic preparedness and response in UHC, and ultimately the threat to human security. I think we all agree with these points, but they're very important. So as I've pointed out, and as you've pointed out as well, the GHIT Fund and UNDP are preparing for a new strategic partnership in the next 5 years. And this leads us to a very important question about how can we better leverage our existing partnership, make it more agile, make it more effective, and identify the new and needed partnerships for greater impact. So we're hoping to learn from this webinar, which brings together key stakeholders who play critical roles in the innovation, access, and delivery value chain. And we're excited to be exchanging and learning from each other. And without much further ado, let me introduce our panel. So I'm going to start by introducing the panelists. And I'd ask them all to put on their cameras when we introduce them. I'll introduce them all together, and then we'll go through a round of questions and then hopefully have a dialogue with each other. I'm very, very delighted to introduce our panel today. Together, they bring knowledge and expertise from government, multilateral system, finance, research, manufacturing, as well as regulation and delivery, all of which are critical to enabling progress towards health and human security. Let me introduce them in turn. Dr. Sultani Natendechero, Dr. Sultani is the head of the National Public Health Institute of Kenya, and was previously the head of the Division of Vector-Borne and Neglected Tropical Diseases in the Ministry of Health in Kenya. Dr. Padmashri Sampath. Professor Sampath is currently the Senior Advisor of the Global Access in Action Program at the Berkman Klein Center, Harvard University, also a leading expert in technology development. She's also serving as a Senior Advisor to the President, Pharmaceuticals and Health of the African Development Bank Group. Dr. Osamu Kuni, who is the CEO of the GHIT Fund, which is an international public-private partnership fund that mobilizes Japanese industry, academia, and research institutes to create new health technologies for malaria, tuberculosis, and NTDs. He's a global health professional with decades of experience. Dr. Kuni was previously the head of strategy, investment, and impact at the Global Fund to fight AIDS, TB, and malaria. We're also joined by Dr. Sheikh Diane. Dr. Diane is the head of the operations of Diatropics, a nonprofit production platform at the Institut Pasteur of Dakar. Diatropics has been established by the Institut Pasteur de Dakar in the Foundation for Innovative New Diagnostics, the Mérieux Foundation, and the French National Research Institute for Sustainable Development. Next, we are also joined by Dr. Margaret Nodomondo Segonda, who's the head of the AMRH Institute, or initiative, sorry, at AUDA NEPAD. AMRH was a response to the national regulatory challenges in Africa. The AMRH also serves as the foundation for the establishment of the African Medicines Agency, otherwise known as the AMA. And last but not least, we have, last but not least, we have Dr. Margaret Gayapong. Professor Gayapong is the director of the Institute of Health Research at the University of Health and Allied Sciences in Ghana. She coordinates the SAVING Consortium, Sustainable Access and Delivery of New Vaccines in Ghana, a multi-sectoral initiative to address implementation challenges for the delivery and uptake of new medical interventions in Ghana, funded by the EDTCP. So quite an illustrious panel. Let's start first with Dr. Matendechero. And I have the first question for you. With COVID-19, we have seen the link between resilient health systems and more effective pandemic responses. How will the new National Public Health Institute, with its mandate to coordinate health functions, help with enabling greater pandemic preparedness? So Dr. Matendechero, over to you.
Yeah, thank you. Thank you very much, Mandeep. I think this is a very timely discussion, especially as you have correctly put it, as we are struggling to emerge out of the COVID situation. Now, what the COVID pandemic has made clear to all of us is that our public health systems are burdened by slow response times to public health emergencies due to uncoordinated efforts. That is something that we have been able to observe, because we were not able to respond in time and probably contain the pandemic at source. So it's a very big lesson that we are carrying with us. At the same time, another thing that we have observed, courtesy of COVID-19, is that our public health programs, we have seen a reduced impact of these programs, and yet they are intended to improve the health of the population. So one of the things that we have asked ourselves is why? Why is it that our public health system is so unable to manage such situations or such crises? So the first thing that we observed is that public health functions are fragmented, and spread across multiple government ministries and sectors. So that you find in the health sector, the human health sector, we are trying to implement some functions. Others are being implemented within the animal health sector, livestock, wildlife. Others are being implemented within the water sector, environment. So there are a lot of players, very key stakeholders who are trying to implement these functions. But now, when they are implemented in the uncoordinated manner, we observe duplication of efforts, We also see wastage, massive wastage of resources. And the other thing that I think played out quite a bit in the COVID-19 situation is the lack of leadership and accountability, so that nobody is taking up leadership. And even when we are trying to respond all at the same time, we find that there is a big problem. Now, interestingly, even as we are duplicating effort, you'll find that there are some key functions that are being left unattended because of this uncoordinated kind of approach. So the National Public Health Institute that we have established in Kenya becomes the solution, because it now becomes the single focal point that various public and private sector entities recognize as leading and coordinating the public health functions. So you'll find that now public health activities are being implemented in a well-synchronized manner. We are able to prevent such public health emergencies much better. And I think, a previous speaker alluded to it. We are able to better detect public health emergencies, as soon as they happen. And we are able to prepare ourselves much better, even for future pandemics and even outbreaks and epidemics that might arise. We are also now able, because of the coordinated effort, we are able to have efficiency, and we should be able to respond much better in case we see another pandemic. And, mind you, we are expecting that with the kind of globalization that we are observing today, the increased interaction in terms of trade, in terms of, general engagement, international, engagements, we are expecting to see another pandemic much sooner than we would have expected. And of course, the Institute also brings about the whole issue of recovery, even after we have experienced pandemics. So I just want to pause at that point and say that this is something that we would like to see replicating globally, so that all countries, all states can have such organized institutions which can interlink, so that even if a public health threat is identified in another country, we can all have a system in which we can now implement global action and be able to stop such threats at source. Thank you, and back to you, Mandeep.
Thank you so much. I think very, very clear points on the need for leadership, a coordinated response to really improve the timeliness of how we respond to outbreaks, and perhaps even prevent outbreaks from becoming pandemics. Maybe we'll get into the recovery piece a little bit more, because that's an interesting point. Let me now move to Professor Sampath, and I want to encourage the panel members to, if you feel like coming in on something that's been said by another panel member, please feel free to do so. We really want this to be a dialogue. So Professor Sampath, my question to you, the recent WHO report tracking universal health coverage in the WHO African region noted the need for investments in health system resilience, both for enabling effective response to emerging threats and the continued provision of essential health services. So this means investing in common goods fundamental both for attaining UHC and health security simultaneously will be key. What do you think are the financing implications of this strategy? And what are the kinds of partnerships that can help contribute to this aim? So Professor Sampath, you're very welcome.
Thank you so much, Mandeep, and thank you for this great opportunity to be on this panel. I think that this report is very, very important and very interesting, because it emphasizes on the common goods that are essential to attaining universal health coverage and health security simultaneously, and also places an emphasis on the attainment of SDGs, particularly the Sustainable Development Goal 3. So linking these three aspects of healthcare and health coverage, together. Now, what I find really interesting is, and here Mandeep, I might just deviate a little bit from your question, is that normally we take universal healthcare as something that's fundamentally dependent just on how we finance healthcare. So we basically talk about how much of healthcare is financed through out-of-pocket expenses versus, government funded, and what's the accountability of this financing infrastructure within countries. Now, what this report does, in a certain sense, is that it takes this whole concept and expands this to include issues of health security and the Sustainable Development Goals, thereby expanding simultaneously the financing implications, right, through a whole spectrum of healthcare activities. And this spectrum of healthcare activities, if you read this report carefully, is not just about reforming health systems, strengthening health systems, increasing the coverage of drugs and services in health systems, but it's also about ensuring the introduction of drugs, vaccines, and diagnostics in a timely manner, which talks about really financing, which then brings it down to how do we finance and strengthen national regulatory agency to perform their tasks? So how do we finance the right kind of market incentives? Because the report talks about common goods, basically global public goods, and pharmaceutical firms don't have the right kind of market incentives to enter small markets, actually. And we know, and all the data shows us time and again, that drugs, especially patented drugs that are critical for saving lives, they're introduced in lucrative markets, but they're not introduced in other markets in the world, particularly low-income countries, for quite a long time. And often this major time lag translates into a lack of access to appropriate healthcare. So how do we create the right kind of financing incentives for those kinds of timely market introductions? Then at a second level, it talks about, I think, unpacking this, we need to talk about availability. So availability is not just about having the drugs, but having them, or vaccines or diagnostics, but having them in substantial quantities, having them in a way that can be accessible, meaning affordable, to the local population, and also having the availability of capacity and capabilities in different countries to produce these drugs, vaccines, or diagnostics when we need them. And this is what the COVID experience shows us. The COVID experience shows us basically that even if we have timely drugs and vaccines, these are not timely available in different places, which means that we need to finance the production infrastructure. We need to have ready production infrastructure when we have a next pandemic or when we have a local health crisis. And this needs to be financed too. At the third level, the common goods relate to accessibility, meaning we need sufficient amounts of generic firms that are operating in different contexts, trying to constantly introduce competitive products. We need to bring down the prices. We need to strengthen the regulatory capacity to see when is a patent going off market, what is the need for this to be produced in a generic way, how do we allow other firms to step in, who are the other suppliers, and how are we going to finance that gap, which we have substantially in a wide variety of drugs, vaccines, and therapeutics today. So for me, the financing challenge of this report is massive. And it's something that when we talk about financing universal health coverage, and we refer to in normal computations, it's something that we don't cover. It's insufficient. So we definitely need to expand and try to lay out what the financing implications of this will be.
Thanks so much, Padmasree. And I think really, really important points, and just picking up on, the elements of financing that are really required around regulatory capacity, pricing, financing, production infrastructure. I think there's a whole other conversation on supply chains in terms of just physically getting them to places, which we've also seen play out during COVID. And I like this point about availability. It's really about affordability, accessibility, capacities and capabilities to produce and get them to people in need. So really, really good. And we'll come back maybe to some of these points more in the discussion. Thank you very much. Okay, over now to Dr. Cooney. The GHIT Fund has maintained its focus on neglected diseases during the COVID pandemic, despite the assumed pressure to divert. What was behind this decision? And do you think there's a case for PPPs like the GHIT Fund and other PDPs to consider a strategy that can enable them to rapidly respond to emerging threats? So Dr. Cooney, over to you. You're very welcome.
Yeah, thank you very much, Mandeep. Can you hear me?
Perfect.
Okay, that's great. So actually, it was before my joining GHIT. Actually, I joined GHIT this March. And before that, as Mandeep introduced, I had been working in a global fund for 9 years. So I asked my colleagues what happened in this question to respond this question. And they said that there was a kind of pressure. And also there was a kind of a request from partners and other people. So actually they kind of reviewed some of the requests of financing, this pandemic, the research and development of new tools for COVID. But it seems that not scientifically robust, so they rejected. And at the same time, the GHIT was not so much active and proactive in this sense because first, usually we have a kind of a request for proposal and all kind of a due process. And it was not so much kind of a emergency fit one. So it would be kind of difficult to change. And the other thing is even neglected tropical diseases, we have 20, and tuberculosis, malaria. Those are huge demand for this R&D. And our funding is quite small. We have just only 200 million US dollar in the past 5 years. So it is not big. As you know, we need 500 million even to develop one, drug or others. So we just stay focused on our core mandate. But now we are now discussing the new strategy, 5-year strategy starting from next year. And we are thinking maybe we need to stay focused on core mandate, NTD, tuberculosis, malaria, but we also make most of that the current momentum of pandemic preparedness. And we can try to use these opportunities and momentum toward our core mandate. And even this time we had the kind of our technology could be converted into COVID one. Finally, it is a kind of a rapid testing of rapid test could be used for COVID. So at the same time, we can also utilize our the experience into pandemic preparedness. That is why we are now thinking how to utilize current pandemic preparedness response opportunities toward neglected tropical disease and tuberculosis and malaria. As you know, TB, malaria, and NTD has a kind of increased due to a disruption. And even funding in this research and development is maybe shrinked. I talked with a variety of donors and PDP, and I found that a lot of money moving toward the pandemic preparedness, but not in the existing one. That is why we need to be kind of bridging between this NTDTM and existing one and the pandemic preparedness. Maybe better to stop here.
Great. Thank you so much, Dr. Cooney. And I think a really important point about leveraging the core mandate of TB, malaria, and NTDs for PPR, and then leveraging the momentum in PPR to support the core mandate. And I think it's a very interesting way of looking at it, because I think it's definitely more impactful to look at it both ways rather than just focus on the one. And just looking at the epidemiology of NTDs, TB, and malaria, I think we're very grateful that GHIT has stayed focused. The GHIT Fund has stayed focused on these three, but at the same time is looking at broader PPR efforts. So I just want to encourage participants online to put any questions they have into the chat. And we've got a couple coming in already, which we'll come to after we hear from our last three panelists. So let's move now to Dr. Diagne. The Diatropics project rapidly moved from a startup in 2019 to one of the biggest developers and suppliers of COVID rapid diagnostic tests in Africa. What, in your view, were the key factors of this success? Dr. Diagne, you're very welcome.
Thank you very much, Mandeep, and thank you for the invitation. I think this discussions come with at the right moment because of the Marburg cases we have seen popping up in Ghana, and also the new Ebola cases popping up again in DRC. We know that countries must be ready for the next epidemic or pandemics. So first, I would say that Diatropic initiative started before COVID-19, but it was more about advocacy, getting the right funding to set up the building, and the COVID-19 has helped us coordinate efforts and deliver it very, very quickly. I would say key factors for success are first, a strong collaboration, a North-South collaboration with companies that were willing to openly share their technology with us and also train the team in order to manufacture their product. Those companies also supported us in the sourcing of key reagents and components to manufacture the diagnostics, when we know that supply chain was very broken and cost of reagents was very highly expensive, letting Africa outside of the diagnostic market. The second key factor for success, I would say, is the environment in which Diatropics is niched, because Diatropics belongs to the Institute of Dakar, and as we know, manufacturing is in the DNA of the Institute of Dakar. The Institute has over 80 years of manufacturing a WHO pre-qualified vaccine, which is the yellow fever vaccine, with knowledge in addressing market needs in terms of health products, quality assured health products. IPD is also strongly collaborating with the West Africa Health Organization and the Africa CDC, among other partners. And this supported the capacity building in research for COVID-19. And these were very useful to Diatropics, because if you look at the clinical trials, we had the right skills at IPD, Institute of Dakar, to support the an accurate evaluation of the COVID-19 product Diatropics manufactured in order to get regulatory approvals. And also in terms of implementation, the epidemiology team supported the implementation in all the primary healthcare centers in Senegal in order to replace PCR or half testing where PCR wasn't available. Also, Institute of Dakar is very connected to public health leaders in the continent, and that allows to distribute very smoothly the Diatropics product. And finally, I would say another key factor for success is the financial model, the innovative financial model Diatropics has set up. It is like the Netflix model, meaning we have members that are supporting the fixed costs of the platform. And that allows us to run operations in a way that is delinked from commercial returns. That allows to have a very high quality products and also very cheap that are accessible to all the populations here in Africa. And this collaboration and the support from members also helped us improve our capacity in terms of manufacturing with the support of ACTE. Now Diatropics is setting up a new facility that will help us get over 50 million tests a year. And this will help us reduce the manufacturing costs and also propose other type of COVID-19 tests like the self-test. I think it's better to pause here. Thank you.
Thank you very much. And I think a very, very interesting model in terms of, making sure that you were linked to, clear production capacity, the links and the relationships with, African leadership and mechanisms, that can help and facilitate the introduction, I imagine, like the AUDC, and then the financial model, having an innovative financial model to really serve as the incentive to produce and to distribute. So very, very interesting. Okay, thank you. So let's move on to Dr. Nodomondo Sigonda. The first question I have for you is, what is the assessment of how the regulatory ecosystem in Africa has performed in the context of the COVID pandemic? So this would include not just the regulation of health technologies, but also other medicines, diagnostics, and vaccines. What do you think were the factors that challenged national regulatory systems in African countries, and what can be done to address them, including through leveraging new and existing partnerships? It's a bit of a mouthful of a question. So it's how the regulatory ecosystem performed during COVID, and not just covering COVID, but covering other health technologies. And what are the factors that are still a challenge? And how can we address these, including through partnerships? So, Dr. Nodomondo Sigonda, over to you.
Thank you very much, Mandip. And thank you for the invitation to participate in this discussion. When it comes to the performance of the regulatory ecosystem on the continent during COVID-19, I think it's best to sort of reflect back from where we started before COVID-19. Before COVID-19 pandemic, Africa had already built an infrastructure for strengthening regulatory systems through the African Medicines Regulatory Harmonization Initiative, which essentially aimed at really supporting the AU, the African Union, in terms of implementation of the pharmaceutical manufacturing plan for Africa to provide an enabling regulatory environment for production of medical products that meet internationally acceptable standards of quality, safety, and efficacy. So that is the foundation in which the African regulatory ecosystem is embedded in. And this initiative started in 2009 by working through the regional economic communities to strengthen regulatory capacity, taking into account that countries were having various and multiple regulatory challenges, ranging from, inadequate legal frameworks, unavailability of financial and technical resources for them to undertake regulatory functions, but also lacking the necessary infrastructure to regulate medical products. So based on that foundation that has been built over years, and through the workings through the regional economic communities where the regulators come together, they conduct, first of all, harmonize regulatory standards and make sure that they facilitate marketing authorization of products in a faster way. So we were able to use that infrastructure and also use the existing expertise through what we call the continental technical committees that constitutes the experts from the national agencies to now come together and provide guidance in terms of regulation of medical products. So we have a number of technical committees so far continentally, and one of them, of course, is called the African Medical Devices Forum, which was very instrumental in facilitating approval, for instance, of medical devices and in vitro diagnostics during the COVID-19 pandemic. But also they were able to issue guidance on import and export control, and also provide countries with guidance in terms of which manufacturers produce personnel protective equipment, PPEs. But in addition to that, we also had very active technical committees. This is the African Vaccines Regulatory Forum, which also serves as a technical committee for clinical trial oversight. They were able to issue guidance document on the emergency use approval of COVID-19 vaccines. And they've been also very instrumental in facilitating joint review of vaccines for national approval. So through these structures, we've been able to really see also that the countries were able to use the regional platforms to undertake, for instance, a virtual inspection of manufacturing sites and eventually be able to approve products that are coming through national processes. And so based on these foundations that were built over time and the work that was done by the Continental Technical Committees, we've also been able to see that African countries eventually have rallied around the ratification of the Treaty for Establishment of the African Medicines Agency as a key pillar for ensuring sustainable strengthening of regulatory systems on the continent. But in terms of challenges, I think I must say we still are faced with a challenge where countries do not have very robust legal frameworks, where they would lack sort of, having autonomous institutions to be able to have robust regulatory infrastructure at country level. So that's one point. But also, we've also seen a situation where countries don't have the necessary resources, be it financial resources or human resources, to be able to undertake some of their activities. And so through these efforts that we have, we've been able to create structures, as I mentioned before. But one of the key structures that we have put in place is the establishment of the AMRH Partnership Platform, which brings together various partners that provide either financial support or technical support to strengthen the regulatory capacity on the continent. And through this AMRH Partnership Platform, the idea is to make sure that we have coordinated efforts to support regulatory system strengthening, but also we have collective impact in terms of really seeing the value for which we are investing in strengthening the system. And so I think what is key here is the work that we have done to come up with a 5 years work plan that facilitates partners' support in terms of not only strengthening regulatory system, but also to look into how we can collectively operationalize the African Medicines Agency as an institution that is going to sustain all the gains that we have accrued so far in as far as regulatory ecosystem is concerned on the continent. And I want to thank here the UNDP, who have been a very key partner to strengthening the legal frameworks at country levels, supporting countries in various regions across the continent. And we believe that through this partnership, we'll be able to really have a more coordinated effort in trying to mobilize the needed technical and financial resources to support regulatory system and harmonization efforts on the continent. So I'll stop here for now. Thank you.
Thank you so much. And I think what really stood out for me is, both the complexity and the breadth of what is required for an effective regulatory ecosystem. And you pointed to, I think, 3 important challenges around financing, capacity, and infrastructure at the country level, which is needed to facilitate introduction of new health technologies. The other point I think, which was really, really interesting, was the point about the AU, the regional economic commissions and the role that they play, the role of the AMA, and the other sort of institutions that have been created in Africa that contribute or are part of the ecosystem. And it's striking. I mean, you started in 2009, so this is not work that can happen overnight. It's and perhaps I think that's something for us to reflect on. If that's what it takes to strengthen regulatory harmonization and address regulatory challenges, what are some of the things that we can do to quickly or accelerate strengthening capacities and streamlining processes and increasing collaboration, so that we can be more agile as we respond to outbreaks and hopefully prevent them from becoming pandemic. So that's, I think, really, really rich set of points. Thank you very much. Let me now move over to Professor Gayapon, our last but not least panelist. I want to ask you about the Saving Consortium in Ghana, which aims to enable effective access and delivery of health technologies, including the rollout of the RTSS vaccine for malaria. What have been the major learnings from your work with the consortium?
Thank you very much.
Yeah,
thank you very much. Can you hear me?
Yes.
Okay, thank you very much, Mandeep, and to the organizers for the opportunity to share these experiences. Let me say that the Saving Consortium was born out of lessons that we learned during the phase 1 and 2 of the Access and Delivery Partnership work spearheaded by UNDP in Ghana, where we had partners in the Food and Drugs Authority, the Ministry of Health, Ghana Health Service, come together to work on various issues that relate to their work in terms of the access and delivery of new health technologies. So when it came to regulatory issues, issues around pricing, issues around delivery, issues around service and the patients. But interestingly, even though they are along the value chain, they appeared not to be talking much to each other. And then we also identified that they were deploying interventions, but they were not looking at some of the challenges that related to the deployment of these interventions and trying to address them. So then the call from EDCTP came at a strategic point, at a point in Ghana where we were introducing the new malaria vaccine, and at a point where we felt, oh, okay, in phase 1 of the access and delivery, there was no new health intervention for us to put the lessons that we have learned into practice. And so we used this as an entry point. Shortly after we started, COVID struck. And so we had to relook at our approach to dealing with things, malaria vaccine in normal times, and then COVID vaccine in an emergency. And so what we decided to do right at the beginning was to do a needs assessment. What do people need? What do these institutions along the value chain need to be able to address some of the challenges they face when such new health technologies are deployed? And we did a needs assessment, and interestingly, we were looking at implementation research needs, and then also needs to do with health technology assessment. And in terms of expertise with implementation research, I mean, the partners were like, about 3.5% of them said they were confident about doing implementation research. When it came to forming multidisciplinary teams to address issues, just about 16% of them said they were confident. When it came to identifying and prioritizing issues, just about 12% said they were confident. And when it came to the importance of stakeholder and community engagement in terms of interventions, just about 10%. And then the worst case for us was where it came to translating research into policy and practice, and just about 3.5% of them said they were confident. When it came to HTA, many of the participants felt that they were not confident enough about issues related to vaccines and new health technologies. 33% of them were not confident of statistical and reporting issues related to issues to do with vaccines, and so many other things. And so we decided to pull them together and have some capacity building activities. And that is the whole focus around which the Saving Consortium was built, doing the needs assessment and trying to address them in a systematic way. One of the things we realized, and you asked about major lessons that we are learning, is that sometimes institutions deploy interventions for the public, but they don't consider themselves as part of the public. So for instance, one of our institutions is deploying an app for adverse events reporting. And in the baseline, when we're doing the needs assessment, we asked a simple question: how many of you who have deployed this to the public have downloaded the app? And just, I mean, less than 10% of them had downloaded the app themselves. So we're asking, so what are you telling people to do? In fact, if you've downloaded that app, it's quite a complicated app to fill. I experienced COVID. I tried filling out the adverse event reporting form using the app. It was so tedious, I stopped. So we are trying to look at some of the implementation challenges in that area. And then we realized that they are really not engaging properly. So a group thinks that something works well in one country, it is brought to another country, and we don't engage to see how adaptations can be done. And that is what we are trying to do here with the Saving Consortium. And then the whole issue of introducing new health technologies in a stable situation versus new health technologies in an emergency situation. We're realizing that our partners, Food and Drugs Authority, Ministry of Health, try to do some rapid assessment and give advice to the government on the kinds of vaccines to use for COVID-19. We had several at our disposal. By the time they came up with their results, government had moved ahead and taken decisions on what they wanted to do. So the whole issue of the time it takes to be able to do HTA, the time it takes to be able to do research, vis-a-vis the time governments need to take to make decisions because of public outcry, are some of the things that we are picking up and learning as we move along with the Saving Consortium. And it's interesting that several proposals have been written. We've just completed the proposal development phase. Our colleagues are getting ethical clearance, and we are really looking forward to seeing what kind of results are going to come out from the research that they are going to do. Let me pause here for now. Thank you very much.
Thank you very much, Professor Gayapong, and I think some important points on learning and applying lessons as you go, the need to streamline processes and the difference between introduction in an emergency rather than in a stable situation. I think all very, very relevant in terms of lessons that we want to learn. So let me go to a round of questions from our participants, and we've got quite a few coming in. So what I'll do is I'm going to pose 3 questions, and then I'll ask anybody on the panel who wants to come in, and maybe each panelist wants to take a minute or two on the, up to 2 minutes on the question. So I'll come around to all the panelists in order again. So we've got one question on, which is about mobile point of care digital radiography. And the question is as follows: Africa is behind in rolling out mobile point of care digital radiography and could benefit from PPPs which foster the introduction of these digital solutions. Are there any initiatives between the government of Japan and private manufacturers in Japan that could foster the introduction of these kinds of tools, particularly the deployment of screening tools for TB and other pulmonary diseases, as well as COVID? We have another question about how do PPPs facilitate technology and tech transfer, and to what extent does this include R&D? A question from the perspective of the private sector: what are the major last mile challenges in terms of timely delivery of medicines, diagnostics, and vaccines in rural areas? And perhaps maybe a reflection on the public sector participant perspective on this. And then how can the partnerships approach contribute to the task of effectively monitoring health technologies at the last mile? So let's take that round of questions first. And let me start. So anything in there or anything you've heard from your panelists, let me start with Dr. Matata-Dechero. Do you want to reflect on any of these questions? Anything?
Okay, I think for me, I would just like to say that the partnerships that are existing today generally are quite instrumental in driving our our control and elimination efforts, not just for programs like TB, but it spreads over to even other public health programs like the neglected tropical diseases, where we are implementing mass treatment, and we are seeing a lot of support from stakeholders in Japan and of course other places in the world. So it is something that we really appreciate, and definitely that's the way to go. We really need to ensure that these partnerships are strengthened and made much more efficient. I think that's what I would like to just contribute and give it back to you.
Thank you. And I wanted to follow up on that response. I mean, often we have partnerships in specific disease areas. Is there scope for leveraging some of these partnerships or connecting and kind of breaking out of the silos, as we say, to try and have more nimble and maybe more impactful pandemic responses or new disease in responding to new disease outbreaks? Do you see any particular scope for that from where you sit in the Public Health Institute?
Absolutely. I think it just comes to now, a better prepositioning of the support that is coming in, especially when we are looking at it in terms of pandemic preparedness, the whole range, whether we are talking about epidemics, outbreaks, kind of like making sure that we have prepositioned our countermeasures much better. So whether it is around human resource, we really need to be able to look at how are we prepositioning so that in the event of an emergency, we do not disrupt the whole public health system. We actually look at how we can quickly recruit our resources, whether it is in terms of commodities, because this is something that really cuts across the general spectrum. We are able to quickly, during peacetime, we are able to recruit. Using these partnerships, we are able to recruit whatever commodities we need. And even in terms of preventative countermeasures, like, for example, vaccination capacity and, those other important countermeasures that we really require when we are faced with the emergencies. So I think it's about being able to sit around the table and look at how we can be able to maximize on the efficiency of these very important partnerships. Thank you.
Thank you. So drawing on the assets that you have across different disease programs and being able to pre-position, I think that's a very, very good point. Okay, let's move on now to Professor Sampath. Anything in particular that you want to respond to from the questions? Maybe the tech transfer, technology and tech transfer question, or the perspectives from the private sector. So over to you, Professor Sampath.
Thank you, Mandeep. Yeah, I definitely would like to talk about the tech transfer question. And I think it relates very well to the point you just made. So if you take the history of sort of like local production or partnership initiatives, in what we've done in the past in the area of healthcare is that we've focused on particular diseases. So we focused on HIV/AIDS, we've tried to focus on malaria. And a risk of this is that we tend to get sort of like siloed in to a particular disease. And this poses certain kinds of problems for technology developers, particularly in the private sector, who actually work in low-income contexts. And the problem there is that what do they do and how do they diversify and how do they access different kinds of technologies that they need for those diversified product baskets, which are required really to produce profitably and over a period of time. And this is a question that comes up again and again when you work with the private sector in different African countries. How do you move from one product or two products, which are a focus of a certain partnership or an initiative, to making a sustainable and profitable enterprise? Also, how do you move really from, say, setting up fill and finish facilities or just formulation facilities to something that is much more integrated towards building technological capabilities of these firms or technology developers over time? And I think that this is a very important thing, and we need more initiatives that address this kind of stuff through public-private partnerships. I want to talk about one particular initiative that has just now been created in the African context, is the African Pharmaceutical Technology Foundation, which is actually an initiative of the African Development Bank. And this has recently just been approved by the board, and it is a foundation that has been created to address exactly this need, this pillar of technology access, which is really central to the private enterprise for production of drugs, vaccines, or diagnostics. And it really is requiring something which is much broader than what we normally construe as technology access in these partnerships. The foundation, it's going to perform a whole series of different tasks, which is actually meant to facilitate a wider access to technology platforms for African firms, but it will also promote a structural approach to address the constraints for technology in Africa, meaning that how do we strengthen the activities of local firms with local R&D enterprises? How do we actually really identify the technology gaps that exist actually in the private sector? And what kind of public-private partnerships can we actually really initiate, really in terms of PPPs, but also product development partnerships that really reflect these technology needs of the firms. And it will also work with the African private sector dedicatedly really to enhance the technology readiness of the firms, meaning that when technology is shared, how do firms absorb that technology and how do they actually use that technology through firm level strategies to say, okay, this is a particular technology that can be used to produce drug A, but how can we move from there to different kinds of drugs or other technology platforms?
Great. Thank you so much. And I think a really interesting model that you've described in the Pharmaceutical Technology Foundation and its role around facilitating wider access and really bringing the all three P's to the table, as it were. Okay, let's move on to Dr. Cooney. Any of the questions or comments from panelists that you'd like to reflect on?
Yes, sure. I can respond to maybe first and the second question. First question regarding this X-ray mobile one. Actually, yesterday I facilitated the TICAD's official side event of a Japanese kind of initiative to the solving African health issues. And at the time, I got a good presentation from Fujifilm. Have you ever heard of Fujifilm? It is a kind of company, initially, the company of film for camera, but nowadays expanding toward healthcare. And they are already developed a very good mobile X-ray with AI-based diagnostics. And also they have also mobile ultrasound and etc. And I've seen that they have already implemented in 24 countries, including maybe 5 or 6 countries in Africa. And they provide very good this mobile technology X-ray. And it is AI-based diagnostics. So you can, get diagnostics, not only just COVID, but other, pulmonary or respiratory diseases, and even for adults and the children. And, automatically it is diagnosed by AI. So that the preciseness of diagnosis is very good. Maybe you can contact Fujifilm. Maybe you can just go to Fujifilm the homepage, and there might be some kind of a grassroots type of grant in. Maybe you can consult also Japanese embassy. And also I found that there are a lot of startup or some business persons from Japan working in variety of countries, even in Senegal. Recently, I visited Senegal and visited your company as well. And that they started, providing solar system together with extending the mobile connectivities. And there is other kind of packages of solar system plus health centers, some kind of installment of several apparatus and etc. Also, they worked for some health technologies and the informatics and also health information system. And and also even mobile monitoring of the cardiac programs, because as you know, Japan is very much advanced in this kind of apparatus for even non-communicable disease. So they could really support that those kind of mobile technologies in Africa. They stop here.
Okay, thank you so much, Dr. Cooney. I think some very, very important examples there. And I do think, certainly from the UNDP perspective, we certainly see the frontier for health system strengthening really being around the introduction of more digital point of care technologies, digital solutions more generally, and then, the introduction of solar in health facilities. And, we're doing some exciting work with the Global Fund on smart facilities for health, which are exactly this, bringing the renewable energies together with the digital solutions. And I think it's an incredible investment in sustainability and the resilience of health systems using these kinds of solutions. And the other point which you made, which I think is really important about this, is that, this is kind of the broader system strengthening that pandemic preparedness and response can sit on. And very important investments can be made by the private sector as well as the public sector in this, and through PPPs. Okay, let me now move to Dr. Diagne. Anything from the questions that you've heard that you want to respond to, or comments made by the panelists?
Sure, Mandeep. I can talk about how the health technologies are monitored at the last mile. I think this is very important to do, but it comes to responsibility. It means who is doing it. Is it the company that is giving its technologies, which is usually in the northern countries, or is it the local company that is getting the technology? From my perspective, I think that it is better that it is done by the local company, because it will have more understanding of the setting, but also of the population. I can give the example of our COVID-19 nasal test deployment in the south of Senegal. It is a nasal test, but we have seen some people using it as a nasopharyngeal test, and they were bleeding. But because we are very close, it was easy for us to go there and train them, rather than this being done by the South Korean company that is miles away. And I think a way forward to do this kind of study is the local company to get the ISO 13485 certificates, because this allows the company to run this kind of monitoring through what we call the post-market surveillance. That will help monitor what we call the usability, but also get very good feedback from the end users. It can be done by having boots on the ground to fill in formulas, or it can also be digitally done. Yeah, that's my take.
Right. Thank you. And I think a very important point about partnership between the company and local institutions, which is critical. Okay, yeah. Let me move now to Dr. Ndomondo Sigonda. Anything from the questions or what you've heard from your fellow panelists that you'd like to come in on quickly?
Thank you. I think for me, when it comes to tech transfer, it's an area that in regulation of medical products becomes really an issue that needs to be addressed. We've seen a situation, for instance, where with existing mRNA vaccines technology introductions on the continent, and the commitment that governments have made, for instance, with various developers, for instance, the government of the Republic of Rwanda, Senegal, and Ghana wanting to introduce mRNA vaccine technology, and the limited capacity that we have on the continent. We've realized that the only way for the countries to be able to manage that is really to partner with more stringent, for instance, regulatory agencies, for them to be able to provide the needed talent and skills on how to provide oversight on those new technologies. So it's an area that we are still working on, and we are also encouraging countries to work collaboratively together. For instance, currently we have a situation where Ghana and Ghana Regulatory Agency is working collaboratively with the Rwanda agency to make sure that they are able to jointly review those new technologies that are coming, for them to be able to provide the necessary regulatory oversight. So it's an area that is critical, but also we require concerted effort to making sure that we eventually the countries are able to approve products that are meeting, safety standards so that the public is not jeopardized in terms of their public health. So thank you for that.
Thank you very much. And I think an important point also about connecting capacities and learning across countries, in addition to, strengthening within countries, really seeing how countries can collaborate and work together and learn from each other. I think it's very, very important. Okay, let's move to Professor Gayapong. Thank you for your patience. I know you had your hand up. Any of the comments or questions that you'd like to respond to?
Yeah, thank you very much. So I just wanted to add to what Dr. Saltani talked about in terms of public health response to some of these issues, especially the pandemic, and to share the experience from Ghana, where we ended up seeing COVID-19 not really as a health issue, but as a developmental issue. So what the presidency in the country did was to bring people from different sectors together: health, education, immigration, together to form a committee to be able to address different issues to do with COVID-19 at the same time. So when it came to the lockdowns and the airports and the sea and the land, already you had immigration and co trying to deal with it. And then you had the public health group also trying to deal with issues at the facility level. And I always say that without our public health system, with our weak health systems that we have, without our public health system in Ghana, we may have run into a lot of trouble, because already they are used to surveillance, they are used to contact tracing, they are used to all these things that happen at community level. If we had had several cases troop into our health facilities, we would have had a major, major disaster. So strengthening health systems at the lower level, strengthening our public health systems, and getting community engagement and involving community health workers in some of these interventions is really critical. At least we found it very, very useful at country level in Ghana. And even trying to dispel some of these misconceptions, because the vaccines are there, but people don't want them because of some of the misconceptions that they've heard about them. Getting our own health workers to help dispel some of these things is really critical and has helped in trying to deliver some of these vaccines. I saw a question about how do you get vaccines down the last mile to the community level, and some of the challenges have been around misconceptions. In Ghana, some of it has been political, because it said this political party in power is introducing this, and so people who don't ascribe to a particular political party will not be interested in it. So there are several contextual complexities that surround some of these, the introduction of some of these new technologies, which go beyond health. And it's important for us to look at some of those complexities and be able to address them moving forward. Thank you.
Great, thank you so much, Professor Gayapong. And really this point about multi-sectoral coordination and approach is very, very important. So in addition to coordinating across the health sector and across disease programs, the need for multi-sectoral coordination and the role of community engagement and community health workers and really the last mile challenge, I think is vitally important. Okay, we're going to move now towards attempting to conclude, I think, what has been an incredibly rich discussion with a lot of things for us to reflect on and think about how we can take some of this learning forward. But let me first give the floor to Dr. Cooney of the GHIT Fund to take 4 to 5 minutes to give us his thoughts on what he sees as the major points, lessons, recommendations coming out of our discussion today. Over to you, Dr. Cooney.
Okay, thank you very much. Thank you very much for a very active, discussion. My take, and also considering that COVID opportunities, because COVID is a crisis, but at the same time opportunities. We really got the vaccine available within 1 year, right? And currently we have 40 vaccines already approved. So we really need to make most of these opportunities toward, of course, a future pandemic, but at the same time, unmet needs. We have so many existing, threats and also epidemics. So how to work together? One of the very important keyword is, of course, partnership. But partnership should be very much strategic, and also much more kind of alignment is needed. So especially R&D, currently we have a very ambitious mission of 100 days mission, as you might know. So we try to make available the safe and effective vaccine and other new tools within 100 days of pandemic starting. So we really use this momentum, how to just coordinate and collaborate for this mission. But at the same time, we also need to think about the connection and also alignment with the access and delivery, because we failed in this equitable access and the delivery. So we really need to look at the very much strategic planning and strategic partnership at global level, regional level, and country level. And recently I visited Africa, and I found that African CDC and other kind of manufacturing also, and even R&D. Recently I visited Senegal, and IPD, that the Institute of Path to really kind of establish a big building for R&D and also manufacturing. So at the regional level, at the African continent, really make a really strong ownership in this regard, and also strengthening, the health system at country level. So these kind of alignment and also effort on the country and the region would be very, very important. Maybe better to stop here. So thank you very much for all the active the discussion.
Thank you. And I think, this point that you've made about really engaging with the incredible capacity in institutions and mechanisms on the continent is very, very important in terms of linking as part of it's probably the most important link in the global, regional, national sort of chain. So let me also take the liberty of sharing a few thoughts. I mean, I think we all agree the pandemic has shown us that investments made in health systems and towards universal health coverage contribute to greater effectiveness of COVID-19 response, but also pandemic response more generally. Through the Access and Delivery Partnership, which is led by UNDP, we've worked with our partners to strengthen health system functions, which I think in many cases have been very useful in responses to COVID. Just as an example, working with WHO, we've reached 43 countries in Africa, 14 countries in Asia, with initiatives that have strengthened regulatory capacities and harmonization. In Ghana and Tanzania, they have, moved to a maturity level, an increased maturity level similar to that of Thailand, India, and Indonesia. So we're going to continue to leverage our partnerships in this area, including working with the AUDA, NEPAD on regulatory harmonization in Africa, especially through the domestication of the model law. Secondly, we're really excited about the developments for the pediatric formulation of praziquantel. And we've partnered with stakeholders in Tanzania to prepare for the availability and introduction of this treatment. And this is where, we now need to, I think, start thinking about strategic partnerships that can enable manufacturing and production capacities in the region, ensuring affordable access. And perhaps there's a lot to learn from the diatropics experience. We know that, successful access and delivery is well worth the effort. Dr. Cooney also, I think in COVID-19 pointed to to the continued failure in this area. The science has been incredibly rapid, but, we failed to deliver and to increase access to these vaccines in an equitable manner. Just on the pediatric praziquantel, as many as 6 million children under 5 years in Tanzania are at risk of schistosomiasis. These children are currently not covered by mass drug distribution campaigns because we don't have an approved medicine for this age group. Regionally, with scaled up access across sub-Saharan Africa, pediatric praziquantel could be available to 170 million at-risk children under 5 in 41 endemic countries. So, you know, it's a very, very important challenge for us to get right in terms of how we can accelerate the access and delivery of this pediatric formulation. And third and final point, you know, Professor Gayapong has talked about the work of the Saving Consortium in facilitating a multi-sectoral approach for the effective rollout of the malaria vaccine. This is very much about leveraging partnerships across national, regional, and global levels. And the point that she made about, you know, cross-country engagement, coordination, learning, I think is a very important one. And if we could facilitate the successful scale-up of the malaria vaccine in Ghana, we could reach 4.2 million children under 5 at high risk of malaria. So, you know, the impact we could have is very, very significant. You know, we already project impact of across the pilot countries of Ghana, Malawi, and Kenya if this on the malaria vaccine, if it's scaled up nationally to reach 14.4 million children under 5 at high risk of malaria in all 3 countries. So tremendous potential. And on a regional scale across sub-Saharan Africa, the vaccine could reach, you know, we could avert up to 33 million cases per year, which is extraordinary. So I think we have to keep our eyes focused on impact, be open to innovation, adaptation, and really learning from each other and really building on synergies, you know, being open to new partnerships and learning lessons. I don't think we do that well enough in the global health community. There's a lot more we can do. And I really, really am delighted by the quality of the discussion we've had today. So many interesting insights for us all to think about and to learn from. And so this webinar has been one part of the conversation in contributing to how we can learn and work together more effectively in pandemic preparedness and response, but also in efforts to respond to TB, malaria, and neglected tropical diseases. So with that, I'd really like to thank the panel speakers, and I'm sure everybody online will agree they were excellent. Thank you very much for making time. Thank you to all the participants and for your questions. I know we didn't get to all of them, but I hope you're putting them in the Q&A and that we're responding in writing, and we'll also, you'll get a chance to see those. And on behalf of the co-organizers, the Ministry of Foreign Affairs of the Government of Japan, the GHIT Fund, and UNDP, thank you very much for taking your time to be with us today. We hope it's been a useful conversation for you. Thank you, everybody.
Thank you very much.
Thank you.
Thank you, Mandy.
Thank you very much.
Thank you, Amanda. Thank you very much.
Thank you.
Thank you very
Bye-bye.
much, Mandy. Bye-bye. Bye.
Bye-bye.